Okay, I think we are all set and set up here with everything streaming. And I think we've got a few people that are on the call, and then there'll probably be some folks watching this on Facebook as well. And we will try to keep an eye on Facebook for questions that might come up. So I have that open on one of my computers too. So I'm Mike Urgo, First Selectman for the town of North Stonington, joined by Steve Mansfield, the Director of Health for our area. I appreciate people who've taken a moment to join us in this general conversation about where we're at with COVID-19. And we thought it would be a good opportunity to provide a little bit of an update on kind of the state of the town, but also the state of the area. And I have a few questions for Steve, and then Steve probably has some things he wants to add, and then we'll open it up for general discussion. I'd like to be only take a half hour of everyone's time, but we certainly want to answer any questions that there might be out there. Steve, one of the first things I'm wondering about is how can we build some more trust with this vaccine? I think that's one of the biggest hurdles we have. I've talked to people. I think they have real concerns about getting it, and we know that that's really the answer that would have kind of held us off from getting back into this situation. But what are your thoughts about that? Can you give any insight?
Sure, and Mike, you're absolutely right. The vaccines are the biggest key to where we are right now, or I should say the lack of vaccines in certain individuals and certain populations that have contributed a lot to the fact that we're seeing this resurgence. I think the best way to explain the vaccines or to encourage people to get the vaccine is the fact that the science supports the safety of the vaccine, of all of the vaccines, not just one. The efficacy or how well a vaccine does its job varies a little bit between vaccines, but they're safe. All vaccines have some risks. And of course, those individuals who are against vaccines in general or specifically against this vaccine may latch on to side effects that are very public, they're publicized and they're out there, but the side effects related to the vaccine are really low when you look at the number of people who have been vaccinated. So they are safe, and as a public health practitioner, I'm very happy that they are safe, and I'm very confident in supporting the vaccine and encouraging everyone to get the vaccine. We are seeing an increase right now in the requests for vaccine. A few weeks ago, we would have been happy to get 6 or 7 people at our 2 or 3 pop-up clinics that we have every week. We're way into the double digits now and seeing people who have a renewed interest. And I think that is due in large part to the Delta variant and the fact that we are seeing people get sick again. We're seeing hospitals have increased numbers of people in their wards, and everyone should understand that when a virus is out there in the population, if we don't get ahead of it, if we don't acquire herd immunity, it naturally mutates. It wants to survive. It wants to keep moving. So until we get a lot more people vaccinated, we risk not only the Delta variant and the other variants that are out there, but variants that may be more transmissible. And of course, we hope not, but they could be more transmissible and more virulent. They could make you more ill. So vaccines are the number one thing that we can do as a community to get ahead of this pandemic.
I know that the vaccines, at least the Moderna and the Pfizer, I think we're around a 95% efficacy, and I think people are hearing about people getting COVID even with having the vaccine. Obviously, it wasn't 100% guarantee with the vaccine anyway, but the science that I'm reading about, and you can concur if you agree, is that those few people who, and it seems like it's a very minimal amount of people who are having these breakthrough cases, they do have much less effects from COVID if that were to happen. Can you talk a little bit about that?
Sure. The latest numbers I saw in Connecticut, I think we had somewhere around 1,000. Don't quote me exactly on that number. I don't have it in front of me, but somewhere around 1,000 breakthrough cases. So breakthrough cases are those cases among individuals who have received both doses of the vaccine or a single dose in one case. So it is a small number. And of course, you hear about those cases. We're seeing cases anecdotally here at the local health department. Those types of cases are only reportable to the state level. So we don't know within our jurisdiction how many people who are fully vaccinated actually have come down with it. But I think the best way to describe what happens and describe, or I guess provide a rationale for some of the new recommendations is to give a real life example. So for instance, I'm fully vaccinated. I have been for months. This afternoon, I could come in contact with someone in any setting. It could be in my work setting. And if I'm not wearing a mask and they happen to be infected with the Delta variant, they may not even know they're infected. They may be asymptomatic. They may have very, very mild symptoms that they chalk up to allergies or something like that. Even though I'm vaccinated, I could be infected with with COVID or perhaps the Delta variant. And then I could not even know that. And then I could come home at the end of the day and infect my 81-year-old mother, who is also vaccinated, but her symptoms, if she were to come down with it, would likely be much more severe than mine and the person who infected me. So although the chances are much less that you're going to get it, and even less that your illness will be severe, in most cases you're asymptomatic, you don't even know you're sick, you still have the ability to transmit it to other people. So everyone should keep in mind, you're not just protecting yourself, you're not just protecting your family, you're protecting everyone that you may come in contact with in your day-to-day activities. And that's why you should be wearing a mask, to make sure if you do come in contact with someone who has COVID, if you are infected, and if you know it or not, you are making sure, or at least giving some more assurances that you're not going to pass on that virus to someone else.
I think that's a great point, Steve. And it was one of the other just questions that I wanted to just touch base with you on. And that was about the masks, because as you just really eloquently described, I think from the very beginning, most people that were wearing masks, you're wearing them to protect others, not necessarily yourself. And that's certainly the case right now with those who have been vaccinated, because you really are at a pretty low risk of getting COVID, although this virus could continue to mutate if we don't get it under control. And that may be a problem going forward. But as you just described, wearing a mask to make sure, you may be infected. I also am vaccinated and got the vaccine the earliest possible date I could, and wouldn't want to inadvertently infect somebody else, especially those, anyone, but, there's people who aren't eligible to get the vaccine, like, younger people who probably would like to get it and are very vulnerable, to an infection. So, that's an excellent point. Right now, I know that I noticed on the call, at least, and maybe watching online, there's some business owners who are interested and Governor Lamont just kind of came out with his directive that he empowered the local municipalities to make decisions on mask mandates and things of that nature. I know at Town Hall, we have reinstituted masks for anyone coming into Town Hall, including staff, unless they're at their desks working. Do you have any thoughts about that?
Sure. So as many of you, I'm sure most people on the call have heard already, the governor just issued a new executive order, which updated the previous executive order, and it really focused on recommendations. There were a number of changes, but the one that I think took a lot of us by surprise, we didn't know what was coming out, was the recommendation to give authority to local municipal leaders to make decisions about mandating masks. As you may or may not be aware, the previous executive order actually had a clause in it that said people like Mike didn't have the ability to put in place a restriction or an order that would conflict or contradict or be more stringent than what the governor said. In this case, there's kind of a caveat. So Mike Ergo could say, I'm going to put in mask restrictions that is specific to my municipality and that all, whatever category he's thinking about, would have to wear masks. So it really takes, I think, the burden off of the governor's office to make that decision statewide. and puts it on the municipal leaders to make that decision. And I understand the rationale for that for sure. There are pockets in our communities that are under-vaccinated. There are pockets where infections are more prevalent. So it may make more logical sense, but everyone should remember, just like any respiratory illness, it doesn't follow borders. Just because you live in North Stonington or you go to a North Stonington restaurant doesn't mean you're protected if you go to Groton and they happen to have a more lax mask mandate. So it doesn't follow any restrictions in terms of geographical boundaries. I think that's important to keep in mind. Right now, Ledgely Health District is not recommending any mandatory restrictions for businesses, organizations, and so forth. We are recommending that municipalities put in place a mandate for restrictions within municipal buildings, i.e. Employees and the public who come into municipal buildings should be wearing a mask. And again, just a reminder, we found out about this. I found out about it by reading the newspaper, honestly, an online newspaper last night. So we weren't prepared for this. We're less than 24 hours out. What I've heard from my municipal leaders and actually the municipal leaders across the Southeastern Connecticut Council of Governments is that none of them have any imminent plans to put in place any mandatory restrictions. Of course, that could change if the case rates go up or mandates become mandates at the state level. But now I don't see that happening in any of our municipalities as of 12 o'clock this afternoon.
I think that's a good point, Steve. And you know, obviously you and I know we're on a lot of conversations with the local municipal leaders. And right now, I think what we want to try to do is we just want everybody to be safe and try to, you know, squash this virus. And, you know, so there is no, it does seem that most of the municipal leaders are following, you know, we would look to the health districts for guidance and certainly the CDC for guidance on things. So there's no eminent plans at this point, but I think the point that you raise is a good one. And I think that's part of the reason there's, whether it's distrust or just confusion, is that this is a virus that things continue to change. And, you know, it's not that science is known, but the virus has been unknown. And so we have had to react as things have gone along. And now the virus is mutating. And I think that does create confusion for people. So, you know, I think part of this call and the things we've tried to do over the last year are really inform people as we go along, and knowing that, you know, things can change as a week goes by or a day goes by as we get new information.
Right. Absolutely. That's a great point. And I think that what you said about new information is a perfect segue to a little local data in North Stonington. Mike, I'm sure you've looked at the data that we sent out yesterday regarding case rates and the number of new cases in our jurisdiction. Yesterday, we were up to 128 cases, which, if you remember, just a few weeks ago, were in the single digits as far as, and that's district-wide, 9 municipalities in Southeastern Connecticut. Last week, North Stonington had 19 of those 128 cases. So based on the population of North Stonington, it had the highest case rate, almost double that of any municipality within Ledgely Health District. So from a rate perspective, that is the number of people who get ill per 100,000 people, there are a lot more people in North Stonington getting ill than in New London, in Groton, Waterford, Old Lyme, East Lyme, and so forth. So so the question is, why is that happening? Are people less vaccinated in North Stonington? Are they not heeding any type of social distancing? Are they not wearing their masks? It's really hard to put a finger on that, but I can tell you specifically, because the North Stonington population is so small, it doesn't take much to throw that case rate of 26.1, to throw that really high. So in this particular case, we had an outbreak among a social gathering, a family that got together. There were mostly vaccinated individuals at this gathering, and a lot of people got sick, and then they got a lot of other people sick. So it can be one event, it can be one social gathering, where we have a cluster or an outbreak. And of course, our contact tracers are kept very busy by those district-wide. But I suspect next reporting period, next Friday, North Stonington will probably be much more in line with the rest of the municipalities within our jurisdiction. But it's a reminder, just because you're vaccinated doesn't mean that you can't get COVID, that you can't transmit COVID, and that you won't give it to someone who may be less susceptible or more susceptible or more likely to have severe illness. So keep in mind your neighbors. If you haven't been vaccinated and are considering vaccination, I think we all have to do our part to protect our community.
And I think, as we said at the beginning, I think we want to try to protect our neighbors, our families. And if you do get the vaccine, if you were to get COVID, the data is showing that, the very mild type of symptoms. So it is a much safer thing for you to have the vaccine, and any of those side effects are, they're minimal, and the data from our professionals is all pointing to, please, consider getting the vaccine. I think we've talked for about 15 minutes or so, and I really wanted to have an opportunity to have a little Q&A with anyone who had questions. I am monitoring the Town of North Stonington Facebook page. If anyone's out there watching and wants to comment, I will ask those questions live. I am recording this meeting, so we will post this as part of my weekly update. And I do see that I have some folks on the line, and I can see that our own Christine Wagner, Chair of the Board of Education, has popped her video on. So I'm wondering if she may have a question or just wanted to be a live participant here. So Christine, welcome, and thanks for joining today. Did you have a question for Steve?
Yeah, I have a lot of questions, actually. Just in talking to people, and I think where a lot of the confusion comes into is obviously COVID now is completely different than what COVID was a year ago. I mean, we talked about, you gave the example of getting COVID when you're vaccinated, not having symptoms, the very slight possibility of bringing that home to an older grandmother who maybe couldn't get vaccinated. How is that different now than maybe if I were vaccinated for a flu? I got the flu and I brought it home to that same grandmother that maybe could get ill from the flu. Is there something significantly different now with the new COVID? Obviously, it's a virus, it's always going to mutate. I'm sure we'll have a new mutation 3 months from now, 6 months from now, 9 months from now. I can't imagine COVID's ever going to go away. So when do we get to a point where we say, with the medications in place to treat this, with hospitalizations on the rise, I understand, but death rate lower, the 19 that we said were ill, were they really ill or were they asymptomatic? Were they vaccinated? When do we get to a point where this is similar in behavior to how we handle flu? Except for that flu obviously attacks children, and fortunately right now this does not.
Yeah, I think, to compare COVID to the flu or compare, two illnesses like that, I don't think it's a good thing to do, because the morbidity and mortality associated with COVID is so much different. It's so dramatically different. So will we get to that point? I hope so. I hope that we have enough people vaccinated, that the case numbers are low enough that we don't have to put in place restrictions that impede people's lives. I mean, no one wants to go through what we went through last year. I don't want to go through.
Right.
What I see in my organization is, we had maybe a month and a half of a lull where we all got to take a little bit of time off, but that's over now. We are back seeing clusters and cases and outbreaks in all of our towns every single day. So at this point in time, I don't see it happening. I don't see COVID moving to a status that is similar to what the flu is or any other illness. It's still changing so rapidly, and it's so transmissible. So about your question about, how is it different? It really has to do with morbidity and mortality and how virulent this is, and the fact that it makes people very sick and causes illness. Makes people very sick and causes death much more frequently than the flu does.
Okay. And then we're at a 95% vaccination rate on people over age 65 in North Stonington. And I know even from at the height of the pandemic and coming from the school side, looking at percentage in our town just doesn't work. The math just doesn't work for the per 100,000, where just like you said, there's going to be cases where we'll have a 2-week period where there's 19 people that have it to one event. And then, like you said, in the next reporting period, there might be 2 or 3. So how do we keep the pulse on that so that there's not this panic of, oh my God, North Stonington's overcome with COVID?
Yeah.
How do we get that message out that these are going to be small incidences in our town and not take it to that statistic that doesn't quite work right in these small towns like it does in a larger district?
Yeah, so I think what Mike organized today is a perfect example of that. And I hope my explanation of that was very clear. If you look at the numbers, the case rates in North Stonington, you may be alarmed. But there really isn't a reason for alarm. What's happening in North Stonington is happening in every other town. It's reason for concern for sure. And from a local perspective, as I said, our contact tracers are, whenever we have a cluster like this, all of our contact tracers are working on that and doing that shoe leather epidemiology, which takes us away from all the other work that we have to do associated with COVID and running, a very large health district. So I think getting the message out there that North Stonington is just like Ledyard, is just like New London. We're all in the same boat. And if we take the appropriate precautions, then we're going to protect ourselves and our neighbors. So the numbers are out there so we can create a standard. It's better, I think, to compare larger, and this isn't my opinion, this is biostatistics and epidemiology. It's better to compare large groups of people over a large or a long period of time than short groups of people, small groups of people like North Stonington over a short period of time. And that's what that 26.1 case rate is showing us. It's a small population over a 2-week period. Much better to look at that case rate, even in a small population, over a longer period of time. So the message is, all our municipalities are in the same boat, and they should be taking the same precautions and being vigilant to keep themselves safe and their families and neighbors.
Okay. And then just 2 more questions. One is, what is the theory behind requiring municipalities to mask, but not other businesses? And then also my last question on that is, what was it? I lost my thought on that one. So I guess that would be my question about why municipalities and not other businesses. I mean, we all go about in different kinds of places all day long. So I'm not understanding really one over the other.
Sure. I think if you were to ask each municipal leader that question, and keep in mind the executive order empowers the executive leader of each municipality to make that decision. I give advice to all the municipal leaders. I'll speak for my own organization. We have had in place a mask mandate within our building for the general public since I don't know the date, but pretty much since the beginning of the pandemic. So if you want to come into our building, you have to wear a mask. There are times where we didn't let anyone in the building except our staff. Right now, even our staff, fully vaccinated staff, wear masks when they're in our building, except that when they're in their office, like I am now. So it's relatively easy for my organization to put in place that that mechanism and that restriction. We can conduct all of our business online. Everyone who has access to a computer can pull a septic permit, apply for a restaurant license. We've always been able to do that, but we've gotten much better at that since the beginning of the pandemic. So it's up to each municipality to decide how much of an inconvenience it's going to be, and then balance that with the restriction. I think the most important difference between municipal restrictions and the general population and businesses and so forth is putting everybody on an equitable scale. I think for North Stonington, for instance, to put in place a restriction for businesses, let's just say they put a 50% occupancy rate or mandated masks, what would that do to the businesses? And would they just go over the line to Stonington or Groton or Ledyard or whatever it may be? I think there are a lot more financial, operational implications to that than there are to municipalities. In short, it's really easy, I think, for municipalities to put in these restrictions to set a good example for our community. And the question over economics and commerce is much bigger. It's a much more in-depth discussion and a much more, I'd say, controversial problem. And I think it absolutely should be done on a statewide basis and not pit one municipality against another.
Yeah, Steve, I would add, oh, thank you. No, I think it is important that we're setting the standard, and that's, you know, why we did it. And I just mentioned that, you know, even last week we had, I'm the vice chair of the Connecticut Council of Governments, and we had our executive meeting and invited Steve and Patrick from ONCUS in to talk to us about, you know, guidance on, you know, where things are at. We're trying to get together as Southeastern Connecticut leaders. It is easier when we make these decisions together, although each community is a little bit different. You know, you know, it's tough at the state level, I think, because things are so differently. You know, maybe Governor Lamont felt it would be better at each town, it maybe being a little different to handle it. You know, although that does make it a little bit more difficult, because consistency is helpful in this. I mean, truthfully, masks should have never from day one ever become a political issue. I don't know how it even did, but it is. So it's a complicated thing to try to navigate here, and we want everyone to be safe first and foremost. So actually, one of the things that we're planning to do here, we do have a stock of masks. You know, as Steve mentioned, you know, we will rely in this town on the health district's guidance, and that guidance has not been to initiate a mask mandate for the town, but we do have some masks available. So I know I have some business owners on the line. If they have a need for masks, they don't have them. We're gonna have some available to be able to give to businesses for your customers. I'll have that on my weekly update today, and contact information if that's something you need. We're happy to try to help in that way. To promote, it does help if people wear masks, you know, it helps. And so I would encourage people to trust and get the vaccine. It makes all the difference. You know, it could save your life, and you know, wear a mask if it's not too much trouble for you. You could be protecting somebody and you don't even know it. So are there other questions from anyone on the line who hasn't asked? All you have to do is raise your hand. Yep, I see Jen Welburn. Welcome. And you don't have to go on screen if you don't want to, but you're welcome to. So, Jen, thanks.
So my question is, as a teacher, sorry, there was some feedback there. I think I'm okay. So I teach in another district and another health district, not Ledge Light. My question, as I think about the fall, I've been trying to learn and educate myself about face coverings on young adults as well as younger kids, and any potential concerns with extensive masking for students who might be in the classroom for 7 hours a day with maybe a break for lunch in between. I really can't find anything online, so I was hoping, Steve, you might be able to give me some background on just like face coverings and young adults.
I wish I could. That's not in my area of expertise. I don't have a clinical background, and I honestly haven't done any extensive research other than reading, you know, the data that's out there that say masks are safe for most individuals. So I'm really not the best person to comment on that. I do want to just make the point that I could even say almost all of what happens in school systems is out of the locals' hands. And I'll only speak for local health districts, but we're not involved in that decision-making process very much. We attend meetings, but those decisions are really made at the Department of Education and the Department of Public Health. And then they trickle down to us and obviously our respective school systems, whether or not it's a mandate or a recommendation regarding mask wearing. One thing I will say is I'm a member of the Connecticut Association of Directors of Health. I'm on the board of directors, and we penned a letter to the Commissioner of Public Health just about a week ago, strongly advising the decision makers at the state to be consistent in their mask wearing policies, whether it's a mandate, whether it's a recommendation, that they're consistent in their message from municipality to municipality, school system to school system. We think it collectively, all the directors of health in Connecticut think it would be a poor decision to leave it up to, for instance, Peter Nero and North Stonington to make that decision. Not that he's not qualified to make that decision, you know, and consult with the people who can inform him best, but it would potentially, as going back to my previous example, pit North Stonington against Stonington or Stonington against Groton. If everyone is making separate and distinct decisions based on the same data, it would cause so much strife in our municipalities. It's better to be consistent and approach things, in my opinion, from the state level, have it come down and treat people the same and equitably from jurisdiction to jurisdiction. And if not at the state level, perhaps a regional level or a level that's consistent with some predetermined level of illness or something like that. Not make it basically arbitrary and in the hands of the local decision makers, myself included.
Thank you, Steve. Any other questions, Jen?
No, that was really helpful. Thank you very much, Steve.
Thank you, Jen.
I think it's really important that we're relying on our experts. You know, we have them. Why? You know, that's where the decisions should be coming from. And just because some of the data does change, because this virus has changed, it was an unknown, you know, thing to us in the beginning. You know, it doesn't mean our experts aren't knowledgeable. They are very knowledgeable and have pointed us in the right direction. It's just we have to be willing to be flexible with this data when it does change. So, do I have other questions from the Zoom call? Anyone can just certainly can raise their virtual hand if they wanted to ask anything. And I'm going to check the Facebook feed while I'm waiting here to see if anybody else has a question on there. I don't see any questions on the Facebook feed. And we are at a half an hour time
I have
slot.
one quick question, Mike.
Yep.
Okay. Steve,
Yeah,
have you heard anything about when the J&J might be available for age 12 and up?
I haven't recently. I keep hearing snippets of information, some from reputable sources and some not so reputable, that it's coming down the pike. I think that will make a big difference. It could be a game changer in a lot of different respects. Not only the authorization of use of these vaccines for younger populations, but even the formal approval of these. I think that will send the message to a lot of people who may be on the fence about the safety or efficacy of the vaccines. It will send the message, okay, this is just like the flu vaccine now. It is just like DPT or any other approved, quote, approved vaccine. So hopefully those things are happening sooner than later. And we'd love to see that happen before kids go back to school or coincide with kids going back to school.
That'd be awesome. All right, thank you.
Thank you.
Thank you. And thank you, Christine, for taking the time to be here today and asking those questions. I know Steve is available or someone from his staff if we need to speak to anyone else. I can't say enough about what Ledge Light Health District has done for our community and our surrounding communities. You know, been here for vaccination clinics, for testing, for these informal educational series that we've been doing, and we'll probably do more of. So with that, I'm not seeing any other questions. If anyone does have any, feel free to reach out to Ledge Light Health District directly, or certainly our office. And I would be happy to, you know, answer any questions we can. And Steve, thank you for your time today. And thank you again to everybody who took the time to be here.
Thanks, Mike. Thanks, everyone. Take care.
Bye-bye now.